Shalom and good morning. We are delighted to have been granted the opportunity to open the presentations at the Russell Berry Foundation's Annual Board of Trustees. With me today are Professor Aryeh Tzaban, President of Bar-Ilan University, Professor Karl Skoretsky, Dean of the Azrieli Faculty of Medicine, Bar-Ilan University, and Professor Chaim Puterman, Associate Dean for Research at the Azrieli Faculty of Medicine. We are excited to have you, the Russell Berry's trustees and professional staff, with us. So good morning, everyone. I invite President Tzaban to open on behalf of Bar-Ilan University. President Tzaban.
Thank you. Good morning, everyone. It's been 2 years since we met you here in Tzfat, in Israel. When I say here, it's not exactly here, because we are now on air, and we don't have you together with us. But going down from Tzfat, we are coming down to earth with a big mission, the big mission of the university, and especially the Faculty of Medicine, which is the Faculty of Medicine of the Galil, a mission to really make a difference, to really generate impact, if we may say, tikkun olam for the world and specifically for the Galil. To make a difference requires a good, innovative, and comprehensive program, requires a team, a very good team, and leadership. The leadership of Professor Skoretsky, the Dean of the Faculty, together with Professor Puterman, Chaim Puterman, and Dr. Sivan Spitzer Shochat. In the last year, our people, our team, together with the team of Russell Berry Foundation, invested a lot of effort in order to build up this program and to generate the ability for us to really transform the Galil. I hope that by the end of this presentation, you will agree with me and you will find it an exciting program for the Galil, for Israel, and if I may say, for humanity in general. Thank you very much.
Thank you, Professor Tzaban. Professor Skoretsky, how does Tikkun Olam relate to the Azrieli Faculties of Medicine's work in the Galil?
Thank you, Sivan. The opportunity to create the impact of Tikkun Olam, which you and Professor Tzaban just highlighted, is greatest when the society of interest is most diverse at the community and population level. In this regard, the Galilee is a unique microcosm of social diversity. Yet, to attain this impact, it is necessary to dig deeply beneath the Galilee's inviting, green, and serene beauty. We have begun on this journey with the intensive strategic planning process for the Galilee Diabetes Sphere, enabled by the generous Russell Berry Foundation planning grant, and in so doing, have been able to uncover and delineate the structural and systemic challenges and potential remedies of the social periphery for the overall health and well-being of all of the Galilee residents.
עבורי, המלחמה בסוכרת היא לא רק משהו ציבורי כחבר מועצה וכמי שמייצג כאן אלפי תושבים. היא גם משהו אישי. מאחר שאני אב לילד סוכרתי, אני מתמודד עם הסוכרת יום-יום, שעה-שעה.
את הסוכרת אני פוגש כל הזמן, גם בבית וגם בעבודה. אני בא ממשפחה שיש בה סוכרת, גם לאבא וגם לאמא, וכנראה גם אני בדרך, וגם בעבודה. אני כמנהל בית חולים פה באזור שחי את הסוכרת כל הזמן.
היום בעולם יש כ-450 מיליון חולי סוכרת, שמאלה 600,000 חיים בישראל. והצפי שבשנת 2040 נגיע ל-650 מיליון בעולם ומיליון בישראל. יש לנו עוד כ-600,000 אנשים שנמצאים במצב טרום סוכרת. כל שנה 6% מהם הופכים להיות סוכרתיים.
There's a very large disparity for diabetes and its complications between the residents of the Galilee and other parts of Israel.
בצפון ובפריפריה, מבחינת מספרים, יש לנו יותר חולי סכרת ל-1,000 תושבים למשל, ובנוסף לזה, החולים האלה הם פחות מאוזנים, יש להם יותר סיבוכים, יותר תמותה מסכרת, והם פזורים מבחינת שטח גיאוגרפי על שטחים יותר רחבים, וזה מגביר את בעיית הנגשת הטיפול ומתן הטיפול האיכותי ברמה הגבוהה ביותר.
לא ייתכן שפה באזור הצפון היחס של מספר הרופאים ל-1,000 נפש יהיה רופא אחד באזור הצפון אל מול 5 רופאים לאותם 1,000 אנשים באזור המרכז.
יש לנו פה כמות סכרת שהיא פי 3 מאשר כל המדינה. באשפוז יש לנו מעל 50% מהמאושפזים עם חולי סכרת. אנחנו פה מבצעים כמות דיאליזה שהיא יותר מאשר 2 בתי חולים גדולים באזור, וזה רק בגלל מחלה אחת, שזה הסכרת.
מבחינת איזון סוכר, יש לנו מדד ידוע שנקרא המוגלובין A1C. בישראל כ10% מהאנשים הסוכרתיים יש להם איזון גרוע, המוגלובין A1C מעל 9%, וזה מספר טוב יחסית לאירופה, טוב יחסית לארצות הברית. אבל אם נסתכל על אזורים מסוימים בפריפריה בצפון, או בכפרים ערבים מסוימים, אנחנו רואים שהאחוז הלא מאוזנים, או יש להם איזון גרוע, המוגלובין A1C מעל 9%, עולה ל-15% ואפילו ל-20% בכפרים מסוימים.
אני רוצה לתפוס כל ילד שיש לו משפחה סכרתית כמוני, ולדעת שהוא לא מגיע לשם. לי יש משפחות שלמות שבתוך הבית גם אמא וגם אבא עושים דיאליזה. גם אמא וגם אבא. תחשבי איך הילדים האלה חיים, איך המשפחה רואה את עצמה. איפה אני, לאן אני מגיע? זה לא איזה אוניברסיטה אני לומד, לאיזה דיאליזה אני עושה, בבית חולים הזה או בבית חולים ההוא.
אני פוגש את המחלה הזו בכל האוכלוסיות, בכל המגזרים, כולם מתמודדים עם המחלה הזו, ועבור כולם זה אתגר לא פשוט.
אם אני כחולה סכרתי צריך ללכת פעמיים בשבוע ואין לי איפה ללכת, אז גם זה חלק מהמחלה. ואם אני כחולה סכרת יש לי את הסביבה שדוחפת אותי בתוך אוכל מיותר ופחות תנועה, יש המון השפעה של החברה. הסביבה פה משפיעה מאוד 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 מאוד. צריך לשנות את הראש. זה לא רק לטפל.
The overriding mission of the Israeli Faculty of Medicine and the decision to establish it here in the city of Tzfat, in the heart of the Galilee, is to use medical education to improve the health and well-being of the communities and population of the Galilee.
אני מרגיש שאם נצליח לעשות חיבור אמיתי בין כלל הגורמים, קהילה, טיפול ומחקר, ביחס לסוכרת, נצליח לעשות שינוי משמעותי מאוד בכל התחום של גילוי הסוכרת והטיפול בה.
What is really striking is that there are an abundance of diagnostic and therapeutic solutions for diabetes. What's the challenge? To get the right test and the right treatment to the right patient in time to make a difference.
צריך לקחת את כל הפרויקטים ולאגם את המשאבים בפרויקט אחד גדול. אין אופציה להמשיך ולחשוב כמו שכרגע חושבים. זה לא עובד. העובדה הבסיסית הפשוטה שאנשים עדיין מגיעים וקוטעים את הרגליים ואנשים מגיעים לדיאליזה ובוכים. צריך חשיבה אחרת.
I believe now you can deeply appreciate why the Israeli Faculty of Medicine identified diabetes as its strategic priority, with the understanding that in order to create real impact in the Galilee, an interdependent link between academic, research, and healthcare delivery must be established. We can see that beyond the devastating effects of diabetes complications on every organ system, it is absolutely clear that the very factors which cause the disparities in diabetes for the people of the Galilee are the same factors which also cause disparities in all aspects of health and well-being. When we address diabetes, we are in effect addressing the broader picture for raising the well-being and prosperity of the Galilee to its greatest potential. During these past 10 months, with the generous support of the Russell Berry Foundation Planning Grant, we embarked on a 3-phased journey of research, ideation, and detailed design, in which we interwove the opportunity to strengthen existing ties as well as build new connections with diverse cultural and organizational partners across the entire Galilee region and reach out for partnerships beyond, including, of course, the Naomi Berry Diabetes Center at Columbia. It is through this year-long planning process that we identify the Galilee region's challenges, needs, and opportunities, designing together with our partners the Galilee Diabetes Sphere.
Thank you, Professor Skóreczki. As Professor Skóreczki described, over the past year, 6 working groups comprised of faculty, community, and healthcare services personnel across the entire Galil dreamed and designed the Galilee Diabetes Sphere. Our mission was to think out of the box and design a comprehensive strategic plan to address the challenge of the widening disparities between the Galil and the center of Israel, creating a model that may be applicable to other social peripheries around the world. The outcome of this work is the creation of Sphere, social precision medicine, health equity research endeavor. As the sphere geometric shape presents one continuous surface, we sought out to create an integrated, transdisciplinary effort that would address the challenges of diabetes. Originally, we really hoped that you would be able to join us and plan to take you across the Galil on a journey of exploration and inspiration into the sphere. But as we cannot have you here with us, I will serve today as your virtual tour guide. So why don't you follow me and join me on the sphere tour. Before we begin any journey, we need to check our map. So let's review our map together, and let me introduce you to the sphere model and our guiding map for today's virtual tour. The sphere is comprised of 4 foundational pillars depicting the diabetes disease pathway of prevention, control, care, and cure. These foundational pillars are complemented by cross-cutting activities to enhance research outputs and connect new knowledge and skills to the Galilee communities through education, implementation and integration, and an infrastructure to support all of the sphere's activities. Our first station of our tour begins in the pillar of prevent. With 600,000 pre-diabetics and a 6% per year conversion rate, prevention presents a major challenge. Let's now go to Akko and meet Dr. Rizan Sachnini, Deputy Director of Maccabi Healthcare in the North, who will be leading the prevention pillar of the sphere.
מניעת מחלת הסוכרת היא אתגר גדול. מערכת הבריאות משפיעה על חלק קטן מבריאות האנשים, כשמדובר בבריאות ולא בחולי. במניעת הסוכרת אנחנו מתמקדים בשתי אוכלוסיות. אוכלוסיית הטרום סוכרתיים, שכדי לטפל בהם ולמנוע את הסוכרת אנחנו צריכים להתייחס למטופל ולסביבה שלו, וגם לנשים שפיתחו סוכרת הריונית במהלך ההריונות. יש הרבה גורמים שמשפיעים על הבריאות, אם זה מצב סוציו-אקונומי, אם זה אורח חיים, אם זה חינוך לבריאות ועוד ועוד גורמים. מניעת מחלת הסוכרת היא אתגר מאוד גדול. אנחנו רואים היום רק את קצה הקרחון. המספרים של הטרום סוכרתיים הם מאוד מאוד גדולים ואנחנו מאבחנים ממש מעט מהם. מערכת הבריאות לבד יכולה לעשות מעט מאוד. בעיקר יכולה לדחות בקצת את המחלה ולא למנוע אותה. כדי להצליח למנוע את מחלת הסוכרת, אנחנו צריכים להביא את כל השחקנים ביחד לסינרגיה מושלמת. אנחנו צריכים להביא את מערכת הבריאות, מערכת החינוך, שלטון מקומי ורווחה שיעבדו ביחד בסינרגיה כדי להביא פתרון הוליסטי שמתאים למטופל ולסביבה שלו.
With a high conversion rate of prediabetes to the onset of disease, control presents another significant challenge in our journey. As Dr. Fayed Hakim noted in the opening film we viewed, improving control can mitigate complications and eliminate phenomena such as dual-parent dialysis. Let us now travel to the Technion and meet Professor Andy Levy, who will be leading the control pillar of the sphere.
In the Galil, there's a tremendous discrepancy between how we treat diabetes and the success in treating diabetes and preventing these diabetic complications compared to the rest of Israel. That is what we want to address in this particular arm of the Sphere program. Why do we have this gap? What is the reason for this crisis in the Galil? I think we need to look at the basic 4 components of what serves as a platform delivery of healthcare. 1, the patients in the Galil have particular handicaps that are not occurring elsewhere. Access to healthy foods, access to medications, even though there might be a small copay, this is just out of their reach. Access to healthy lifestyles, meaning exercise, out of reach for many patients in the Galil. We need to address this. This is the first particular arm of our program. The second, with regard to physicians, we need to educate the physicians on what are the particular targets that we need to attain in order to have adequate control of the patient's diabetes. So to help the physician to become up to date with current guidelines for managing patients with diabetes. The third aspect is how we allocate resources. Resources don't just mean dollars for the different health planning clinics. It also means resources of physicians' time. All patients with that diabetes are not exactly the same, and so he needs help in identifying how he can spend his precious time more efficiently. The fourth pillar has to do with bringing science into the management of diabetes. This program will use what is referred to as precision medicine. We often think of patients with a particular disease as all being very, very similar. What we're going to be doing here is quite unique. These patients will be treated according to the underlying genetic makeup that they have. This will help to focus the attention of the physician on the limited resources that I spoke about before. The Balancing Health program is unique. We're going to be marrying two diverse concepts: social determinants of care, which are limiting patients' access to care, and on the other hand, state-of-the-art precision medicine concepts that will allow us to deliver care to those patients that really need the most aggressive management. The marriage of these two concepts is unique and will allow us to develop a program for diabetes in the Galil that will reduce the discrepancies between what exists in the Galil and the rest of Israel, and also set the standard for diabetes care that will be then viewed by the rest of the world, and we envision adopted by the rest of the world, marrying these two synergistic concepts of social determinants of care and precision medicine.
Creating a synergistic plan for preventing diabetes or improving control by marrying the social determinants of health and precision medicine requires integration among all partners involved in a patient's healthcare journey. Yet this is not a simple task. Let us now travel to Nazareth and meet Dr. Yusuf Auni, Deputy Director of Clalit Health Services in the North, who will be leading the sphere pillar of care to better understand this challenge.
מחלת הסכרת מחייבת טיפול רב-מערכתי. כיום יש חוסר תקשורת מוחלט בין כל הגורמים שמטפלים במטופל. קופות חולים לא מדברות אחת עם השנייה, הבית חולים לא מדבר עם הקופות, המחוז לא מדבר עם בית החולים, קיים נתק גם עם משרדי ממשלה, עם ראשי מועצות, ראשי ערים, אנשי רווחה, כל אלה לא נותנים לנו לתת את הטיפול הרב-מערכתי הנדרש. הפתרון הוא לייצר פלטפורמה אחת שהמטופל במרכז. לייצר אינטגרציה בין כל המערכות שידברו אחת עם השנייה. לחבר יחד את כל מערכת המידע של המטופל כדי שהנתונים יהיו שקופים לכולם. הדבר הזה לא קיים בארץ בכלל, והיום יש ניצנים חדשים לשיתופי פעולה שקיימים בגליל. בתקופת הקורונה היה לנו שיתוף פעולה שנתן את אותותיו לגבי קידום הבריאות של האוכלוסייה בצפון.
Alongside our efforts to prevent diabetes and mitigate its complications, as a faculty of medicine, our efforts in the sphere also focus on restoring health through groundbreaking biomedical research, searching for a cure for diabetes. Professor Puterman, how do we do that?
Thank you, Sivan. Let me introduce the cure pillar to you. The scientific program in cure builds upon pockets of strength, wherein the Azrieli Faculty of Medicine has identified unique opportunities for scientific advancement and research collaboration. To restore health and effectively deal with the different biomedical aspects of diabetes and diabetes treatment, while taking into consideration the unique environment of the Galil, its different populations, their unique genetic backgrounds, and rapidly changing diets, we identified three focus areas in cure: eyelid biology, microbiome, and genetics. Let me briefly explain each of the three research components. The first focus area is eyelid biology. All types of diabetes are characterized by beta cells losing their capacity to produce adequate insulin, leaving the cells of the body in a state of overabundant fuels, such as glucose, which the cells cannot utilize, and which instead cause damage. The faculty already has a sharply focused research program around beta cells, which it will continue, but is not seeking to expand at this time as part of the sphere proposal. A second area is that of the microbiome. That is the huge and diverse set of microorganisms which are part and parcel of our very being. The microbiome resides in the gastrointestinal tract, skin, respiratory tract, and many other organ systems. Shifts in the composition of the microbiome occur during childhood, aging, and pregnancy. Changes in the microbiome are now known to be associated with a growing number of diseases, and prominent on this list is diabetes. Here too, the faculty already has a highly productive research program around the microbiome, which it will continue, and which complements and is of course relevant to diabetes. However, we are not proposing to expand this effort as part of the SPHERE proposal. The third focus area is genetics. The 1.5 million people living in the Galilee constitute one of the most diverse populations in the world, with the highest number and variety of population isolates in a small geographic region under a single national healthcare system. These include numerous and diverse extended kindreds of Muslim Arabs, Christian Arabs, Druze, Bedouin, Circassian, Maronite Christians, Jews from different backgrounds, and other small minority groups. Historical processes during the last millennium and social practices in these communities result in the current human landscape of population isolates that are diverse from one another, but are each extremely genetically homogeneous. This unique population architecture, together with the existence of the very large nuclear families in the more traditional communities, cause high rates of diabetes risk. This makes the Galilee one of the most informative regions in the world for the genetic research of diabetes and a unique asset for forming international research partnerships.
Hello, I'm Wendy Chung. I'm a geneticist at Columbia University in the Naomi Berry Diabetes Center. We're thrilled to be able to collaborate with you, to be able to understand better the genetic basis of diabetes to improve the care of patients. Right now at the Berry Center, we oftentimes use genetics to understand different subtypes of diabetes and how to better tailor the care for those individuals. However, what we see at the Berry Center may not be the same as what we see around the world. So around the world, there are different communities, and based on the ancestry of those communities, there are different genetic conditions and different genetic factors. You really have to be able to study each local community independently to understand that particular genetic ancestry. Within Israel in particular, there are some similarities with the community that we see in New York, but some wonderful differences. And it's really important for everyone to be counted, for every community to be studied individually, to make sure that genetic information we learn is representative and benefits their group. We have very powerful genetic tools that we can use, including genome sequencing, to identify these conditions and identify, in some cases, brand new disorders. And with that identification can sometimes come really profound insight into understanding the pathophysiology or how those diseases sort of manifest and what causes them. And so even though these conditions might be rare around the world, they might be very much more common in certain parts of the world, and they might actually give insight that would help treatment for even common types of diabetes. And so being able to work with communities like this can be incredibly valuable for the entire world of individuals with diabetes. We have opportunities to work together to understand in your local community what those genetic subtypes might be and to help patients to be able to improve outcomes.
It is clear then that there's an untapped opportunity here for making important advances with both local impact for the families of the Galilee and more broader impact worldwide. We strongly believe that there's a great opportunity here for major advances, which require the new and expanded activities which we are proposing for the Galilee Diabetes Sphere in collaboration with the molecular, biobanking, and gene function expertise of the Naomi Berry Center. While each of the three programs comprising the cure is scientifically distinct, the existing microbiome and islet biology programs are tightly coupled with and are driven by the discovery and characterization of genes unique to the Galilee population, thus generating a coherent and integrated biomedical research program.
Thank you, Professor Putelman. As we progress in our tour, let's pause and look once again where we are on the Sphere map. We visited our diverse partners in the four foundational pillars of prevent, control, care, and cure. Yet early on in our design of the sphere, it was clear that research needs to be complemented by 3 cross-cutting activities: education, implementation and integration, and a broad infrastructure to support this transdisciplinary effort. First, let us meet Professor Peter Gilby, Head of Medical Education at the Azrieli Faculty of Medicine, who will be leading the Sphere Education Center.
The Education Center will be focusing on strengthening the now while building the future. We'll be working with our medical students to teach them the importance of community and of the social determinants of health in the prevention and treatment of diabetes. With our postgraduate trainees, the resident physicians in family medicine, in internal medicine, and in pediatrics, we'll be bringing them up to date with the cutting-edge knowledge and skills regarding diabetes. And with our physicians who are actually working in the field, we'll be taking real-life problems from the field and helping family physicians who currently don't have the time or the knowledge to conduct serious research projects to do that and to solve real-life problems. This will be something that will greatly enhance the research capabilities of physicians working in the field and help us turn ideas stemming from the field into real research projects that will have a real impact on the treatment of diabetes in the Galilee. It's very important to start this training from medical school through residency to physicians practicing in the field so that this is actually something that is ingrained into them from day one.
Not only is education a challenge, but how do we ensure that the research developed in the sphere is implemented and integrated into the healthcare system and Galilee communities? Let's travel to Nahariya, to the Galil Medical Center to meet Dr. Amir Bashkin, who will be leading the Implementation and Integration Center.
מחקר טוב הוא מחקר שנותן כלים יישומיים שאפשר להשתמש בהם בשטח. כאנדוקרינולוג שעובד גם בבית חולים וגם בקהילה, מרבית הזמן שלי אני מטפל בחולי סוכרת ויש לי ראייה רחבה של מערכת הבריאות ואני נתקל בפערים מאוד משמעותיים שלא זוכים למענה. היום ידוע שמשלב תכנון המחקר ועד היישום שלו בשטח חולפות בממוצע 17 שנה. השאלה איך אפשר לצמצם את הזמן הזה. החדשנות בתפיסה שלנו שאנחנו בשלב מוקדם חושבים על מודל איך ליישם את המחקר בשטח.
It's really as simple as that. A 17-year gap is inconceivable. To address implementation, from the get-go, the Spheres project will be conducted in cities and towns across the Galilee. This will enable us early on to understand the barriers and facilitators, assuring that research is relevant to real-world setting. The last cross-cutting activity is the infrastructure of the sphere, which aims to solve one of the biggest potential barriers to research: independent access to data. In Israel, as we heard in the CARE foundational pillar by Dr. Yusuf Auni, data is siloed, making accessibility and transparency a challenge. To ensure access to data, the Sphere partners identified key infrastructure elements. Professor Puterman, can you elaborate on one of those?
Thank you, Sivan. The first infrastructure element is establishing a biobank. The biobank will serve projects in the control and cure arms of the Sphere. For example, in the Balancing Health program, blood samples will be taken from which both DNA and plasma will be separated. Our goal here is to understand the genetic composition and its relationship to blood sugar levels and complication mitigating interventions to improve diabetes control. In establishing a biobank, our aim is to enable independent data collection for Sphere projects, while at the same time building a novel and invaluable resource for studying diabetes and its complications for generations to come.
As we conclude our virtual tour, we cannot disregard the disruption of COVID-19. The COVID-19 challenge proved it's a wonderful opportunity to test the power of Sphere. With a generous grant from the Russell Berry Foundation, the Sphere partners, under the leadership of the Azrieli faculty, were able to design a biopsychosocial health platform which was implemented across the entire Galil in just 2 weeks. This platform assisted our community and healthcare service partners during COVID-19 through 2 arms. The first arm of the program focused on improving awareness. With the rise of COVID-19 in the Arab sector, our community partners voiced the lack of awareness to COVID-19 preventive behavior, especially among Arab elderly residents. We created community kits with disposable masks, thermometers, and plain language information sheets in Arabic, and dispatched 11 students to Arab communities across the Galil, such as Sakhnin, Majd al-Qum, and Nazareth, conducting to date over 800 home visits. In the second arm of our program, 80 medical students in their clinical years were dispatched to over 40 clinics throughout the entire Galil to assist primary care teams with the backlog of chronic care patient management due to this pandemic. To date, these students have invested over 8,000 hours working alongside clinic staff. Let us now go to Nofa Galil to meet Hadass and Dr. Michael.
אני סטודנטית שנה שלישית במסלול 4-שנתי בפקולטה לרפואה בצפת. כשהתחילה הקורונה פנו אלינו בעצם שישנה איזושהי מלגה לעזור לקופות החולים בהסברה ובלעזור לרופאים בקהילה. נרשמתי למלגה ושובצתי לעבוד עם דוקטור מיכאל לבקובסקי בנוף הגליל ובקיבוץ יפעת.
מהפגישה הראשונה מאוד התחברתי, כי התחברה מאוד לצוות אליי להפתעתי למטופלים.
זה היה שידוך מאוד מוצלח, מאז בעצם אנחנו עובדים ביחד.
הפרויקט שהדס הגיע אלינו למרפאה תרם הרבה גם למרפאה, גם להדס, גם למטופלים וגם לי כרופא.
הקשר עם דוקטור מיכאל הראה לי פן אחר של הרפואה, פן של רפואת משפחה. כשהגעתי לעסוק ברפואה, חשבתי שמאוד מתאים לי בית חולים והאנרגיות והקצב, ולא הכרתי כל כך קהילה, ורפואת משפחה נראית לי אחרת. הקשר עם המטופלים זה בעצם קשר שהוא אחר לגמרי, זה קשר שהם באים, יכולים לדבר על הבעיות הכי אישיות, הכי פרטיות שלהם, בשבילי להיות בסיטואציה הזאת, שהם נותנים לי את הפתח, שהם פותחים את הדלת. זאת מבחינתי התנסות מדהימה, וזה חוויה נפלאה. זו חשיפה שאני חושבת שבלי המלגה הזאת, לא הייתי מגיעה אליה.
אני מאוד אוהב שיש לנו עתיד, שכשאני יכולה, יהיה רופאים שיטפלו בי.
אני חושבת שבשבילם, בשביל המטופלים, זה עוד נדבך שהם יכולים לראות עוד דמות, שאולי בעתיד תפגוש אותי כרופאה שלהם.
Our tour of the sphere has come to an end. Professor Tzaban and Professor Skoretsky, I pass on to you to close our formal presentation. Professor Tzaban?
Thank you. Following this presentation, I believe that you now understand why Bar-Ilan University views the Galil Diabetes Sphere as its most important visionary and strategic project for years to come. Bar-Ilan University is committed to this project scientifically, strategically, and financially, which is not less important. As a foundation rooted deeply in the Galil and a founding partner in the establishment of Bar-Ilan's Faculty of Medicine here in the Galil, I truly believe that supporting this groundbreaking endeavor aligns with the values, goals, and legacy of the Russell Berry Foundation. The convergence of Bar-Ilan University and the Russell Berry Foundation in the Galil represents a unique opportunity for both partners to implement their aim to deeply transform the Galil, allowing its residents to attain their full health potential. In the words of Thomas Carlyle, the British historian, philosopher, and mathematician, he who has health has hope, and he who has hope has everything. I hope you will join us in this journey of health and hope. Together, we can really make a difference.
Professor Skoretsky?
Thank you, Aryeh. Thank you, Sivan. I would like to conclude by thanking the Bar-Ilan University team led by Sivan, Dr. Spitzer Shochat, Professor Puterman Chaim, as well as the many others involved from the faculty and from our affiliated hospitals and HMOs for enthusiastically dedicating their time and efforts to dreaming and designing the sphere. I would also like to express our heartfelt thank you to the Russell Berry professional team, Ruth, Idana, Binny, and Amit, for continuous engagement and input, which greatly helped us to sharpen and improve our vision and strategic plan for the sphere.
Thank you, Professor Skoretsky. I would like to thank you, the Russell Berry trustees and professionals, for your attention. Tודה רבה again, and it was wonderful being with you. And we really hope to see you in the near future with us in the Galil.
Amen.
Okay. Amen.